So colon and rectal cancer is the second most leading cause of cancer deaths now in the United States. So the colon and rectum is the last 4 feet approximately of our intestinal tract. It's often something that's not really thought about. I mean, our bowels work and we don't really think too much about them, but unfortunately, cancer can occur to where we'll say approximately 5% of patients can develop this disease in the general population. So there are a couple of types of risk factors. One would be risk factors that you really can't do much about. And that's going to be if you have a family history of colon and rectal cancer in relatives, first degree, second degree. Those would be parents, siblings, cousins. Ulcerative colitis, Crohn's disease. These are diseases I deal with as a colorectal surgeon. If one has that disease for a longer period of time, 10 years, 15 years or longer, that may also increase your risk. And then the other component would be lifestyle factors. So these are things that one could modify. So typically here in the States, the American diet tends to be typically low in fiber. So that's going to be low in fruits and vegetables, high in fat, high intake of processed meats, red meats. Those are factors that can increase your risk for colon and rectal cancer. Probably the most common symptom that you would experience would be blood that you can see either with wiping, blood that you can see in the stool or on the stool. Let's say if someone was having bowel movements once a day and there's been a change in bowel habits over the course of time that persists. If the bowel habits become narrower, those would be signs to worry for a potential lower colonic cancer. If you have abdominal discomfort that you didn't really have before, bloating, cramping that just again is persistent over the course of weeks, that would be cause for concern. Colon cancers are usually treated with surgery as the first modality. And depending on the stage of the disease, one would then undergo chemotherapy after the surgery is done. Rectal cancer, that's often reversed. Usually in rectal cancer, we will oftentimes treat the patient first with chemotherapy and radiation therapy. Certainly there would be a lot of fear and concern about surgery, and probably one of the number one questions I get from patients is, am I going to have to wear a colostomy bag? And that is not a certainty with this. Part of our specialty and part of what I do is we try to preserve the bowel, take care of the cancer, and make sure patients are able to live a full life without a colostomy bag. Only in a smaller minority of patients is something like a colostomy bag necessary. From a surgical perspective, operations used to be done with large 10 to 12-inch incisions, and we called that open surgery. But now here in the Sacramento region, myself, amongst other colorectal surgeons in the area and general surgeons in the area, will do surgery in a minimally invasive fashion. And this means we're making incisions 5 millimeters, 6 millimeters in size on the abdomen and perform the surgery either with a laparoscopic approach or actually the Da Vinci robotic surgical approach. Both are modalities that we perform at Dignity Health facilities and have been for at least a decade. I don't want you waiting too long. There's a lot of fear and concern about, or shame even, for a problem in the colorectal area, but we are your ally as physicians. Number one, most patients will have a primary care doctor. I mean, they're a good starting point for most patients. I mean, if they need to do a stool-based test, they often facilitate that. They often are the gateway for many patients to get referrals to specialists like myself. So primary care provider is a good start. The other two types of physicians, one being me as a colorectal surgeon, we do are specialists that do colonoscopy. Of course, we are called upon to treat colon and rectal cancer from a surgical perspective. So certainly we're colorectal surgeons here in the Sacramento area. You can certainly contact us and we can give you advice and help you as needed. The other type of specialist that oftentimes deals with colorectal cancer screenings are gastroenterologists. And they are specialists of the entire digestive tract, basically from the mouth down to the anus. And they specialize in doing colonoscopies, evaluating patients, making the diagnosis of colon and rectal cancer, and making the referral often to us as surgeons to manage you.